Period pain, also known as dysmenorrhea, is a common symptom experienced by many women during menstruation. The pain is usually felt in the lower abdomen and can range from mild to severe. Be sure to watch until the end, because there are a few that I think will surprise you. So if you are ready, let's get into it. There are several possible causes of period pain, including 1. Prostaglandins. Prostaglandins are hormones that are produced by the body during the menstrual cycle. They cause the uterus to contract, which can lead to cramping and pain. Women who experience severe pain during their periods may have higher levels of prostaglandins. 2. Endometriosis. Endometriosis is a condition in which the tissue that lines the uterus grows outside of it, causing pain and inflammation. The tissue can grow on the ovaries, fallopian tubes, and other organs in the pelvic area. During menstruation, the tissue bleeds just like the lining of the uterus, but because it has no way to leave the body, it can cause inflammation and pain. 3. Uterine fibroids. Uterine fibroids are non-cancerous growths that can develop in the uterus and can cause cramping and pain. These growths are made of muscle and fibrous tissue and can range in size from tiny to large. They can also cause heavy bleeding during menstruation and pressure on the bladder or rectum. 4. Adhesions. Adhesions are bands of scar tissue that form between internal organs, such as the uterus and ovaries, as a result of surgery, infection, or inflammation. Adhesions can also cause pain during menstruation. 5. Pelvic inflammatory disease, PID. PID is an infection of the female reproductive organs that can cause pain and discomfort during menstruation. It is often caused by sexually transmitted infections such as chlamydia and gonorrhea. How to reduce period pain? There are several ways to reduce period pain. 1. Over-the-counter pain relievers. Medications such as ibuprofen and naproxen can help to reduce cramping and pain. 2. Heat therapy. Applying heat to the lower abdomen, such as using a heating pad or taking a warm bath, can help to relax the muscles and reduce cramping. 3. Relaxation techniques. Stress and tension can make period pain worse, so it's important to find ways to relax and reduce stress. Techniques such as yoga, meditation, and deep breathing can help. 4. Hormonal birth control. Birth control pills, patches, and vaginal rings can help to regulate hormones and reduce the production of prostaglandins, which can reduce period pain. Hormonal intrauterine devices, IUDs, can also help to reduce period pain. 5. Diet. Eating a healthy diet that is rich in fruits, vegetables, and whole grains can help to reduce inflammation and cramping. If the pain is severe or interferes with daily activities, it's important to seek medical attention. If you like my video, then subscribe to my channel. Thanks for watching.